And I'm going to share screen here. Okay, can everybody see my shared screen?
Yes.
Great. Wonderful. So welcome. Thank you so much for being here, everybody. Again, I'm Sheridan Nicolau, and I'm here with Alejandra Hacker. We're here to give an overview of Medi-Cal and Medicare services. This is provided for the Down Syndrome Connection of the Bay Area. And Kathleen, if you can hit record if you haven't yet, so that way we can start recording here.
Yep, already done.
Great. So the plan for today is you're going to hear a little bit more about CRIL and about the State Council on Developmental Disabilities. We will talk a little bit, we'll give an overview of Medi-Cal, about Medicaid in general and what Medi-Cal specifically offers, eligibility, getting started and how best to use Medi-Cal, some common issues in troubleshooting, and then some advocacy and resources. And similarly, then we'll transition to Medicare, talk about what it is, what the program offers, eligibility, getting started and how to best utilize it, common issues, troubleshooting, and again, some other advocacy and resources. And depending on the flow of conversation, Alejandra and I also have a lot of handouts and websites to share. So we'll see how we do on time. We will definitely make sure you get all of those things in email. We will pass it on to Kathleen and to Marianne to send to you all. But we'll just see how the time goes. We also can share that here during our time with you today. So a little bit about our partners. Alejandra, would you like to kick us off?
Sure. I'm Alejandra Hacker, and I work for Community Resources for Independent Living, CRIL. We provide services throughout Southern Alameda County, down to Livermore, Fremont, San Leandro, and beyond. We provide a variety of different services. Just to touch on a few, we have housing search, benefit planning if you're wanting to go back to work and find out what's going to happen to your benefits, benefit advocacy. We have assistive technology if you need a certain device to help you with your daily skills. We can lend out devices for a month to see how they would work for you. We also have different services. Yeah, a variety of different services. If we don't have the resource in-house, we help you find the resource. So it's just a great place to get resources. So again, I do the benefit planning at CRIL, and I also help with job search and HR duties as well. So thank you for having me today.
That is an incredible heavy load, Alejandra. That is a lot. And thank you for that. And thank you for being here today as our trusted partner. And I can't say enough wonderful things about CRIL, about Community Resources for Independent Living. They are a wonderful ILC, Independent Living Center here in California, serving a good chunk of Alameda County. And for those of you that are outside of Alameda County, there are ILCs throughout California. It's a wonderful network, and some of the services that Alejandra described are available through other ILCs that might be near you, depending on where you live. So feel free to reach out to CRIL or to my office, and we can make sure that you know where your local ILC is. So I'll talk a little bit about the State Council on Developmental Disabilities. And hello again, everybody. Sheridan Nicolau here. I'm the Regional Manager for the California State Council on Developmental Disabilities. I oversee the Bay Area office. So for our federal work, that covers 5 counties. For our state work, some of our state projects, that's, let's see, 10 counties now. So like Alejandra, I keep myself busy as well. And the State Council on Developmental Disabilities is an independent, federally funded state agency. So there's a state council in every state and US territory in the United States. We are both in federal law and in state law. Federal law is the Developmental Disabilities Assistance and Bill of Rights Act. And we are also in state law here, which is the Letterman Act in California. And state councils do a variety of things. And the state council here in California looks a little different than in most states because we're such a unique and diverse and such a large state here in California. Not only do we have our headquarters at the state capitol, where we provide grant funding, both regional and statewide grant funding, policy and legislation, but we also here in California have 12 regional offices that can work directly with their communities to really get to understand local trending and need, to be able to provide technical assistance, systems navigation support, all of that. And I would say the best way to think of the state council is a lot of our work falls into 3 buckets. The first being advocacy. So this is a part of advocacy. So providing systems navigation support, helping you know where you can go and what resources that you can access to be able to help you and your loved ones on your journey, whether that's with Medi-Cal, Medicare, housing, employment, education, other types of generic or disability specific services, civil rights of any kind, access and other opportunity needs. So any of that there. Advocacy, we work a lot with self-advocates, with people with disabilities, as well as their families and the professionals that serve them. Another of those buckets that a lot of our work falls into is capacity building. And so capacity building, we serve on a lot of committees and coalitions, both to share best practices when it comes to equity, rights, and opportunities for people with developmental and other disabilities. But we also are always looking for promising practices, or what's new, what is a new initiative or a promising practice, both here in California or across the United States. So we're always looking for what can make these systems better for people with developmental disabilities and their families. We also provide grant funding, sponsorship, scholarship, sponsorship types of funding as well. We have both statewide grants, we have regional grants, and then year-round sponsorship opportunities for events that are best meeting needs in new and innovative ways for people with developmental and other disabilities. And then the last bucket of a lot of the work that we do is under systemic change. So that's legislation, that's policy, that's a variety of testimony and advocacy on all levels, from grassroots to top down and everywhere in between. So whether that's for local communities, for counties, for states, or some of the national advocacy also that we engage in from time to time. So a variety of that kind of systemic change. And the best part about that is we're working directly with the people to be able to do that. I think one of my favorite trainings or workshops to do is on legislative advocacy and helping people with developmental disabilities and their families pick up their power and know how to make change, whether that's in their local community or their state. So that's a little bit about the State Council. So let's dive right in, shall we? So we're going to get started. And before we talk about Medi-Cal, it's important to know what Medi-Cal is. And Medi-Cal is really a Medicaid program specific to California. And so we're starting there, and we'll also talk about a few other things that's not quite Medi-Cal, but that's important to know so you have a better sense of what Medi-Cal entails. So back to Medicaid. Medicaid is a federal program. It provides health coverage, started back in 1965 with Title IX of Social Security Act, and is funded with a combination of both federal and state dollars, and is the nation's largest payer of healthcare services. And we'll talk a little bit more about this, but the Affordable Care Act has expanded Medicaid in many states. Many states have taken up the Affordable Care Act and have been able to expand eligibility. Here in California, Medi-Cal expenditures are about $99 billion. About 63% of that is federal funding, about 21% is state general fund funding, and then another 16% is other types of state funding, and then local funding like county funding. And the Affordable Care Act, ACA, that was passed in 2010, rolled out in 2014. There's about 37 states that picked that up, and it used that to expand their Medicaid programming. So a little bit more about the ACA, because we do get a lot of questions about the Affordable Care Act as it relates to Medicaid or Medi-Cal services here in California. So as mentioned earlier, it has expanded Medicaid services, including Medi-Cal eligibility here in California. Basically, what that's meant is that more people with disabilities now qualify for Medi-Cal based on their low income status, which means that many people don't have to wait for a disability determination to enroll. So that's pretty important. And Covered California, as many people know, because Affordable Care Act has been out for a while now, Covered California is the state's online health insurance marketplace. That's where anybody can enroll in Affordable Care Act and take a look at eligibility there. So in California, approximately 4 million people additionally became eligible. Those are mostly folks that did not have health care before the Affordable Care Act. And nationwide, about 20 million people now have coverage that they didn't have previously, either because they had too much income or resources than the previous eligibility level covered. So that's an important part when we think about Medi-Cal and how that operates here in California. So then before we dive in more to Medi-Cal specific, I get this question a lot. So we wanted to address this here, which is Medicaid waivers. What the heck is that? First of all, the most basic way to describe a waiver of any kind is think of it as a stream of funding, okay? And usually when we talk about waivers, we're talking about federal dollars, federal streams of funding that are going to states or going to other places. So in the case of Medicaid waivers, a Medicaid waiver is a provision in Medicaid law that allows the federal government to waive rules that usually apply to a Medicaid program. And the purpose of that is to allow states to be able to accomplish certain goals that they have. So in many cases, and we provide some examples here, that could be reducing costs, overall healthcare costs. That can be expanding coverage. That's what California did certainly, and many other states expanded coverage, or improving care for certain groups of people. And this means that states are able to provide services to their residents that wouldn't normally be covered through Medicaid funding. Some examples of this are in-home care for people that would otherwise have to go into a long-term institutional care. So there are many different types of Medicaid waivers that are specific to keeping people in their homes with the right kind of support that they need versus a more institutional medical setting. So we're big fans of these, obviously, for many ways. And then just a couple of examples of more common Medicaid waivers. So home and community-based settings, probably for some of you that have family members that are in regional center services or other types of social services, you've probably heard about home and community-based settings. It's also known as Section 1915C, a type of waiver, and that allows states to provide home and community-based services to people in need of long-term care. So again, the importance here is it allows people to stay in their own home or community setting instead of going into a nursing facility. This is super important because there are a lot of states where even young people with medical conditions and certain types of developmental disabilities end up in nursing care facilities with seniors and with folks that really don't have anything else in common with them. So that's why HCBS and some of these other waivers are so incredibly important that provide individuals and families access to services in their home communities and homes so that they aren't, out of luck and have to live in a more restricted medical setting or an institutional type of setting. Another example is the freedom of choice, or Section 1915B, and that's a waiver that lets states provide care via managed care delivery systems. And then another one that's not mentioned here is called research and demonstration. Otherwise, it's sometimes referred to as Section 1115 waiver. And that lets states test out some new approaches to delivering Medicaid care and financing. So not necessarily something that you're going to be using day to day, but I think it's just helpful to understand the concept of Medicaid waivers and what that allows states to do. And some of the flexibility that it offers, with a good chunk of those waivers really leading to Californians with developmental, other disabilities, or health conditions be able to get the care they need in their homes or in their home community. That's pretty important. All right, so now Medi-Cal, right? So we talked about Medicaid, Medicaid waivers. So what is Medi-Cal? So each state is different in how they run their Medicaid program, but all states have to follow certain types of federal rules. And so Medi-Cal is administered by the state of California, but with oversight and is responsible to CMS, the Centers for Medicare and Medicaid Services. So important to know in terms of how states are able to set up and run their Medicaid services and how California runs Medi-Cal. It's with that oversight from CMS, Centers for Medicare and Medicaid Services. So Medi-Cal pays for essential primary, specialty, acute care, behavioral health care. Alejandra's going to talk a little bit more about the different types of coverage there. Important to know that Medi-Cal provides health care to low-income folks, seniors, people with disabilities, and children. So it serves a wide variety of individuals. And it also includes long-term services and supports. And some examples of that are like in-home supportive services, IHSS, which we'll all be talking more about in a couple of weeks. Can also cover some adult day types of care, waiver services, including some of those through regional centers and nursing facilities, acute hospital waiver. So there's a variety of different things that it can include. So just a little bit of facts and stats when it comes to Medi-Cal. Medi-Cal plays a really crucial role for California in the healthcare system. It also tends to, in some of its pilot projects or in some of its new initiatives, tends to kind of change the way or transform the way that healthcare is delivered in the state and can influence other sources of healthcare. And about 13.5 million Californians are covered. So that's about a third of the state's population. And that includes about half of all California kids and about 10% of adults between the ages of 19 and 64, and covers about half of all people with disabilities. And so in California here, there are 6 managed care models. It's mentioned here on the slide that 80% of all Medi-Cal beneficiaries are enrolled in one of 6 managed care models. Those include, and there's some really good maps online that show, based on where you are in California, what managed care models there are. There's county organized health systems, including we have some of those here in the Bay Area. So that would be county, county specific managed care programs. We have geographic managed care, also sometimes called GMC, 2 plan models of care, regional models of care, and then there's certain particular models of care in San Benito and Imperial regions as well. So for Medi-Cal benefits in some counties, you have to join a managed care plan through Medi-Cal, but in other counties, you can use a fee-for-service Medi-Cal. So depending on the county you're in, you may have different choices of how you can access your Medi-Cal. And some other facts here on the deck, about 58% of all patient stays in long-term care facilities are covered by Medi-Cal. And then this website here is really helpful. There's actually some wonderful graphs that show just some of the coverage, some of the trends in usage, utilization, what it covers. So if we have time later, we can check out that website. But anyway, I wanted to make sure that you had it on the slide here, which is really helpful to get a good sense of how Medi-Cal is operating here in California. And Alejandra, take it away.
Yeah, so as we discussed in earlier, and the eligibility for Medi-Cal here in California or for people with disabilities, it's also linked to their SSI at times. That if you qualify for SSI, you automatically get the Medi-Cal. And there's different ways you can do this. People age 65 and older, this is the age and disabled Medi-Cal, and they have to meet the federal poverty level to receive the Medi-Cal. And of course, children Some children are eligible for Medi-Cal, parents and caretakers, relatives, and adults. So they have to meet the resources to qualify for Medi-Cal. They take resources and income into effect when applying for Medi-Cal. And also,
Let me know when you want next slide.
oh yes, the next one, please.
And also Medi-Cal eligibility, that also includes children regardless of immigration status, right? That's important for people to know.
Correct.
That there are some restricted scope Medi-Cal benefits for folks that are undocumented. So there's some deeper eligibility standards there, but there is more full scope, more benefits offered through Medi-Cal for children regardless of immigration status.
Yes, thank you for bringing that up. Very important fact. And also, as I mentioned, they take into account specific eligibility such as income and resources. When you want to apply, you can go to the local social services office or apply online, www.coverededca.com. So that's a great website to check out if you're thinking, do a qualify, and you want to do some more research. That's a great resource for you to check out. At CRIL, we do answer questions about applying. If you have some questions about your application, please feel free to call me at CRIL and I'll be happy to walk you through it. Before COVID, I used to assist with filling out these applications, but now I'm happy to assist you over the phone as you're applying. You if you're applying with paper form, you can pick up applications at your local social services office, and you can take it home. And if you have questions, please call me and I'll be happy to answer any questions. And also, if you want to apply online, there the covered edca.com can take you to the Cover California website where you can apply online. And of course, you can also call me for assistance if you have any questions when applying.
Yeah. And Alejandra, different Medi-Cal programs use different calculators, and some don't use any calculators, financial calculators at all, right? When applying, is that correct?
Right. It depends on the specific group of Medi-Cal you're applying, where you actually, what you qualify for, depending on your situation.
Great. Yeah. And we can share where you can actually go through those calculators to be able to determine exactly what to apply for before you start the application process. Another
Yes.
important note here is eligibility for Medi-Cal is automatic for enrollees of certain public assistance programs. CalFresh is one of them, Social Security Income or SSP, CalWorks, Refugee Assistance, Foster Care and Adoption Assistance Program. Does that hit all of them, Alejandra? Am I missing any?
Yeah, yes. Those are pretty much the main ones. Yes. I think we got them all.
Great. And as mentioned earlier, undocumented kids have full scope, but folks that don't have either U.S. citizenship or they don't have like lawful permanent resident status, they may have more restricted scope. So they may still be eligible just for more restricted scope services. So don't assume that you or a loved one isn't eligible. It's always good to look into or get some consult specifically from CRIL or from another resource so we can help you determine.
Yes.
Next slide. Yeah.
Yes.
So this is one where I wanted to slip in just some of the major programs. And, today's conversation is an overview. So Alejandra and I are not going to get into all the minute, calculations. We're going to show you where to do that, but we're not going to go in neck deep into Medi-Cal, applying for the different programs. But we have links here that you'll be able to use when you get this deck. And these are kind of the main programs here, right, Alejandra? These
Yes.
are the ones where, even if you have higher income or you're on Medicare, these are the ways that people sometimes are eligible for Medi-Cal programs. So that includes aged and disabled federal poverty level Medicare, sometimes, or Medi-Cal, sometimes it's called A&D, FPL, the acronyms. I'm going to call you Alejandra because I can never get the acronyms straight.
There's
I always
so
have to look at them.
many.
Yeah.
Yeah.
So for that program, for aged and disabled federal poverty level Medi-Cal, if you're aged and disabled and aren't eligible for SSI, you might be able to get Medi-Cal through this program. You have to be 65 or older, disabled, meeting the Social Security's definition of disability. That includes if you are blind or low vision. You have to have less than 2,000 in assets or 3,000 if you're a couple. And that program doesn't count all of your assets. So there's like a whole list of exemptions there. If your disability began before you turn 26, so of course, for our folks with Down syndrome, that's certainly the case. You can open up an ABLE account and save money without having it being counted towards Medi-Cal. Alejandra and I could do a whole hour and a half just on Cal ABLE. It's super, super exciting. So just please make a little note to look into ABLE accounts if you haven't already for yourself or for your loved one. It's really exciting. It's been around for a couple of years now here in California, and I can't say enough wonderful things about that program. Okay, so one of the other categories, or one of the programs that people might be eligible for, is the Age, Blind, and Disabled Medically Needy Medi-Cal program. Again, that acronym, very difficult for me. If you can't qualify for free Medi-Cal or Medi-Cal's Working Disabled program, you may be able to get Medi-Cal through this program, through the Aged, Blind, and Disabled Medically Needy program. However, a lot of people that fall under that eligibility do have a share of cost. There are certain Medi-Cal programs that have a share of cost for the beneficiary. And that basically means it's a certain amount of money that you might have to spend on medical care each month before Medi-Cal kicks in and pays for services. Also here, just to share a little bit about SSI linked Medi-Cal. So if you get Social Security income, SSI, which is a benefit for people with low income who have disabilities or who are older or who are blind, you get Medi-Cal automatically. We mentioned that earlier. You don't have to fill out additional paperwork, for that automatic eligibility. And Alejandra's going to talk about a great website later where you can read more about that. Let's see, there's Medi-Cal's Working Disabled program. So if you are working, you're someone with a disability and your income is too high to qualify for free Medi-Cal, Medi-Cal's Working Disabled program, it can allow you to get Medi-Cal by paying a small monthly premium. And there's, again, you have to look at the Social Security's definition of disability, but you don't have to meet the income and the work requirements. So you can be working and be earning income that way. So there's some definitions there that we won't go into for this overview, but it's helpful. And then you can use pay stubs or other written verification to prove that you're working. So that's a neat program. And then there's lots of other parts to that program depending on how much you work. There's some great calculators for that, right? Especially on DB 101, right, Alejandra?
Yes, there's some great websites out there, and also with the benefit planner, they'll go over this with you when you're ready to go back to work and you're receiving SSI or SSDI or both. So yes.
So don't do it alone is what you're saying. Get help.
Exactly. Talk to a benefit planner.
Great. Back to you, Alejandra.
Okay, some of what Medicare covers, inpatient, which means if you're admitted to a hospital, outpatient for your regular doctor visits, that's covered. Lab work and x-rays are covered. Medical procedures, surgical services of dentist, the surgery portion is covered. For dental. Personal care services, we're gonna talk more about this later, but IHSS, when you get care in the home, that is covered automatically if you receive Medi-Cal, due to the financial requirements. Medical supplies, that can be used in the home, durable medical equipment is covered as well. Next slide, please. And this covers emergency services, nursing facility stays, mental health care and behavioral health, prevention and health wellness, prescriptions, including dental and vision services, maternity and newborn care. So you can see it does cover a lot of what we need, right? So if you qualify, yes, it does cover a lot. So if you think you qualify, apply, because all these services are here for you to use. Next slide, please. And depending on state, I believe state, Sheridan, or these other services may include a optometrist for your eyeglasses, dental services, not just surgical dental, but regular dental services, physical therapy, occupational therapy, and other types of LTSS.
Great, and that's long-term services and supports, right?
Yes.
Great. So services that help people stay in their homes or in their family homes. So if we think about common issues, and again, this is kind of a high level overview because we could talk for hours about the types of cases that Alejandra and I hear about or that people come to and talk about. So I had to think about, okay, what would be a snapshot of a few common issues that people run into with Medi-Cal? And Alejandra, jump in if I'm missing, because you probably hear even more than I do about common issues people have. But the ones that I hear about with the State Council are rates, Medi-Cal rates. The rates are such that it is very hard for a lot of providers and clinicians to be able to provide services with Medi-Cal rates. Healthcare advocacy is really always needed in terms of improving Medi-Cal rates and to emphasize care and specialty services. That's certainly the case in California, which is a higher cost state to live in. Another thing that I hear a lot about from individuals and families is that clinics and hospitals have difficulty or may not be able to provide billing for extra time or care that somebody with a sensory sensitivity or other conditions may need. So, for example, one of the little projects that my regional advisory committee is working on right now is called the Quiet Lab concept, which means how can we make sure that there are more labs in clinics that can offer sensory specific care. So for folks, with a variety of conditions, Down syndrome, autism, people with other types of sensory sensitivities, can you have an environment where maybe it's not so fast, get in and get out, where clinicians and lab professionals can take a little bit more time with you and with your loved one. Is there consideration in terms of the environment, that the environment is more friendly, that it's maybe quieter than some of the busier clinics and labs, that the lighting is better? some of this we know makes a huge difference for us and our loved ones, depending on how their disability manifests and conditions that they have. So that's something that we're always looking to share best practices and to work so that clinicians and hospitals can invest in more sensory friendly environments that can really better accommodate people, whether that's individuals with Down syndrome or with other types of disabilities.
Another,
Yeah, please.
sorry, another issue that comes into my office is people asking why their Medi-Cal is not working, what's going on. So a lot of times it's filling out the redetermination paperwork that comes to you sometimes yearly. It depends on what you checked on the application. It could be 1 to 2 years, 3 to 4, but make sure whatever they send you, make sure you're looking at those Medi-Cal renewal, the Medi-Cal renewal paperwork.
So critical, so critical. And in fact, I have a slide on that next that we'll talk about. I can't emphasize that enough, what Alejandra just mentioned. This is important. Many of you here, probably either yourself or a loved one, your child or another loved one, have regional center services. So again, we could talk for hours on this subject, but for the purpose of today, if you have regional center services, you know that the regional center system is a payer of last resort. What that means is if the regional center is going to be able to fund something, a service, a support, a need of some sort, there are a lot of restrictions and criteria that they have to follow. But more importantly, you will have to access your quote generic services before you work with the regional center to get that funding. So Medi-Cal is one of the largest, if not the largest, generic service. So for certain types of care or therapies or equipment, just know that you will want to you'll need to go through and see if you can get it, if you can secure it through Medi-Cal services first as a payer before using the regional center to fund that service or support or that DME of whatever it might be. So that's very important. If you or your loved one is with the regional center services, please make a little note of that. And when you get the deck, just make note. That's pretty key there. And that'll save you a lot of time too, and hassle back and forth, just understanding that you have to use generic or your other benefits and services first before looking to get certain things funded by the regional center. And then here we go. There's your issue right there, Alejandra. Yeah. So me too. I mean, my office, we do hear a lot of redetermination issues. Redetermination, as Alejandra said, a lot of times can be annually, but not necessarily, depending on the type of Medi-Cal program that you're under. But it's important to stay on top of that. Because if those forms aren't completed, if you're not turning that in, that can cause a discontinuation, a lapse in services, and the worst time to discover that is when you're needing to access care. And then you realize that you've been discontinued or that there's a gap in your coverage because you didn't get that redetermination form in. And just note that, and this is, in this wild year of the pandemic, here is another red flag when it comes to redetermination. We've occasionally heard in different spots of California that there can be delays in processing. So we recommend, if you get that notice, get it done sooner rather than later and stay on top of it to make sure that it gets processed, because there can be delays in processing and that can negatively affect or create a gap in coverage. And you definitely don't want that. This is something else that's happened, and actually we've supported some folks with technical assistance for this. We've heard about incorrect redeterminations, meaning that somebody who's been on Medi-Cal, whether they're a child or an adult with disabilities, has been on Medi-Cal for quite some time. They complete the redetermination form on schedule like always, no problem. and then they get a letter talking about that they've lost eligibility. And sometimes what's happened is whoever worked to process the redetermination used the wrong eligibility, used like the wrong Medi-Cal program. I know, I see your face, Alejandra, because yeah, it's a huge issue. So all of a sudden somebody's benefits get discontinued, and it's because there was a processing mistake through Medi-Cal at the office, usually the local office, and they were their eligibility was looked at for the wrong Medi-Cal program, not the one that they've been in for years, but another one. And so then someone will get a denial notice, and then they have to fight that, to push back, say, this is the wrong program that you redetermined us for. We're eligible under this program. So that is to say that it's very important to make sure you know what program specifically you or your loved one is under with Medi-Cal. And when you go through redetermination, keep an eye on that. Be very vigilant to know how you qualify, just to make sure that there's no issue with discontinuation, because we've heard of that a couple of times. There's actually a family that we've worked with where multiple times this has happened to them, multiple times. And so that's definitely an issue there. So one other redetermination, a couple of other points with redetermination. So because of the pandemic last year, counties were allowed to prioritize the processing of access to care issues and new eligibility applications, and they were allowed to stop processing certain types of annual reviews. So it's possible this last year during the pandemic that maybe you were expecting to get a redetermination, notice, and that you may have instead have been put off, which is terrific, right? As long as you know why. You want to make sure that everything's fine and that there's no discontinuation. Specifically, there was I'll show you later if we have time, there's a letter that gives instructions to counties from Department of Healthcare Services, and it specifically informs eligibility workers to be able to document the reason delayed redetermination processing for Medi-Cal benefits approved due to a state or federally declared major public health crisis, like COVID-19, for example. So just keep in mind that you may have seen some differences or some delayed in redetermination, and that's probably why, because counties were allowed to, depending on the need, to prioritize workload and need, specifically to make sure that access to care issues were handled, which is wonderful, because you want to make sure that that's prioritized so that people don't have an access and care issue. Alejandra, anything else with this? Anything else about redetermination that we want to highlight for folks?
Just if you have any questions, you can always reach out to Krill and just make sure you're looking at all your mail that comes to you. I know nowadays it can get confusing with so many different advertisements that we do get in the mail. So just keep your eye out for anything Medi-Cal might send your way.
Great. And then in terms of troubleshooting, so Department of Healthcare Services, that's where you can find a lot of the documents, guidance, and informational letters that the department sent out to counties, especially those that are COVID specific or pandemic specific. So definitely check those out. Also, another plug for what Alejandra's mentioned, which is get benefit support or counseling, either online or over the phone. If you think there's an issue or you got a letter and you're not sure what the heck that letter means, don't stress out. Just call and get help. That's most benefit support and counseling that's available out there is at no cost to you. So do that. Definitely don't delay. Don't sit on it or put it at the bottom of the mail pile. That doesn't make it go away, that's for sure. Not when it comes to Social Security and not when it comes to Medi-Cal. And if you do notice or you hear that there's kind of a systemic issue or a glitch that keeps happening, please let my office know. I want to know this because I also work with legislative offices. And in some cases, it's important to let legislative offices know, hey, we're seeing a lot of these types of issues in this particular area or in this county or from this particular benefits office. That's important because we want to address those or make sure the right people are looking at those as those issues come up. And then just a quick note on fair hearings. So you do, of course, have a right to ask for a fair hearing regarding your Medi-Cal, whether that's a service issue, care issue, authorization issue. Those tend to be the more common reasons that people might want a fair hearing. There's several different options, and we won't go into all of the options, including some mediation options when it comes to resolving a conflict with your Medi-Cal. But just know that you can look at all of those options on the Department of Healthcare Services website. They have a fair hearing webpage, which then also has a lot of links for you so that you can see what your options are, and then gives you some timelines should you choose to apply for fair hearing. Also important in general when it comes to fair hearings, the Department of Social Services, state hearings, you can get that information there. That's very helpful as well. A lot of those web pages on those sites are meant for you all, are meant for individuals and families to be able to see and look at what these processes are. And you can also, of course, reach out to Alejandra and Krill or reach out to my office and we can talk a little bit about your specific situation. And then I just wanted to share this briefly because, and Alejandra, let me know if you're hearing this in the community. Access to technology in the digital divide, that's a real issue for many populations. But I just wanted to point out that this is also an issue when it comes to Medi-Cal or underinsured or uninsured patients, because a lot of things have switched over to telehealth, which is well and good if you have access to telehealth. But I just wanted to highlight here that in terms of systemic advocacy, many people this last year have missed their needed healthcare appointments, particularly children and adults and seniors with disabilities. Delayed care is very dangerous for many people, especially people with developmental disabilities, multiple healthcare conditions. COVID tracking poll views this is from the California healthcare providers. This is from November 2020, so last fall, they asked healthcare providers in California about access. And you'll notice that 10% said that very few of their patients had adequate access. So basically could not access telehealth services. So I just wanted to highlight that as another issue to pay attention to. Obviously, you're all joining us via Zoom. So chances are you are able to access telehealth services for you, your child, your loved ones. But just wanted to make sure that we knew that this is an ongoing systemic issue. And then we'll go quickly through this, resources and advocacy. So sometimes you just gotta look up the darn statute, right? It's not fun or glamorous. It's great if you have insomnia, but I wanted to make sure that you guys had, the specific welfare and institution codes in California regulation specific to Medi-Cal statutes, and then the code of regs for Medi-Cal and where it is in Title 22. So again, something you probably will not need, but it's good to have in your file. So you probably have an electronic file or a physical file, throw that in there when you get this deck. And then just a couple of other locations for advocacy. So Health Consumer Rights, fabulous website. They have some really great documents there. And then just, if you're having some persistent issues around eligibility or redetermination, this is the office, the Medi-Cal Eligibility Division. So that's not your local office, that's kind of the state office. And you can access it through the Department of Healthcare Services website. Again, very helpful. Hopefully you don't need it, but very helpful if you do need it. All right, are you ready to go to Medicare? And maybe before we go to Medicare, if there are some, and sorry, I'm sharing screen, so I can't see the chat. If there are some folks that want to ask for clarification or have any questions, that's not too personal since we are recording this, this would be a great time before we get into Medicare. Kathleen, Alejandra, do we see anything in the chat?
Yeah, it looks like we've got one person asking, can you comment on recovery?
Oh, on recovery. On Medi-Cal recovery after someone's passed?
Not sure that's all it said. Oh, yes, that's what she says.
Okay. Yeah, I have some really great resources on that. That is a little more detailed than what I'm prepared to talk about today. But if you capture that in the chat or email me or let me know, I can get you a variety of, there's been some changes in the last few years about Medi-Cal recovery, basically meaning what Medi-Cal can come after you or your family for after somebody has died, clawing back some of what they're owed. Alejandra, do you want to talk about recovery or any clawbacks when it comes to Medi-Cal?
I'm just thinking of resources right now. I can't think off the top of my head, but I can look into it as well.
And I will send Kathleen and Marianne some resources specifically on recovery and clawback. It's a pretty in-depth issue. It's an important one, so thank you for asking that. I didn't bring any handouts to share with you today, but I promise I will email those today so that when you get the deck and some of the handouts that we have, you can also read some of the latest about that. I have a couple in my file, so I'll email it. Let me make a note. Great. And benefits recovery or benefits clawback is an issue with several public benefits services. So I'll definitely send some stuff that's applicable to Medi-Cal, but as well as some other general programs too. Thank you for asking.
We've got two questions that actually kind of piggyback on one another too. The first one is the difference between straight Medi-Cal and managed care options. And the second one is there a way to opt out of managed care Medi-Cal?
Yeah, Alejandra, do you want to speak to that?
The difference between the two Medi-Cal and managed care options. Did you want to touch a little bit on managed care, Sheridan? Do you know the difference?
Yeah, so I can also share, I have some handouts on managed care. And let me, for example, let me stop sharing for a bit before we move on here. Let me see if I have a good handout that I can share right now on that actually. Okay, so I'm gonna pull it up. So it depends on the region and the county that you're in, if you have options between managed care, Medi-Cal, or other types of programs. Let me see if I can share the screen that talks a little bit about that. Can you guys see my screen?
Yes.
Okay. Yeah, so managed care, so not every county offers Medi-Cal managed care. Generally what that means is you're accessing your managed care specifically through an established network of some sort that might look similar to what you might access through private health insurance. Oftentimes those managed care services are emphasizing on preventative care, and there's pros and cons with that in terms of ease of usage. Some people really like their managed care programs, and for other individuals, they feel more restricted with managed care. So you can see, let's see, there should be a page here that talks about, well, let's just go. Can somebody give a shout out of what county they're in so that we can?
It was LA County that the question came from.
Oh, okay.
Actually, Contra Costa County.
Oh, Contra Costa?
Yes.
Okay.
Well, there are two, I guess, because one person says they're in LA, but a lot of our members are in Contra Costa too. So I'm glad someone spoke up on that one too.
Got it. So for example, we'll go straight to Contra Costa Healthcare Services. So let's see, what do we have here? So they have specifically through their healthcare services. So let's see. I know that Contra Costa County has had a great plan. So for Contra Costa County, you can choose to use through their health plan services. They also have Kaiser Permanente Child Health Care. So you can see these two different options. Some individuals, particularly I'm here in the Bay Area, I hear that people prefer their county health plans in some cases over other types of managed care options. Let me see here. That's a state website. Let's go to LA County. And basically the best thing to do is to look at your county health website, your county health plan website, to find out, does your county have a county health plan that Medi-Cal can be accessed through? Or is it just through managed care, a managed care plan? And sometimes there's other options as well. So let's see here. My internet connection is slow. Come on. Okay, if it doesn't load in a minute, I'm just going to have to leave you with that to go on the Los Angeles County Health Plan.
I was actually gonna say I wanted to pop in about something. So do you want me to do that while you're waiting for your computer, Sheridan?
Yes.
So two things. First of all, on straight Medi-Cal versus managed care. I actually have two children who are on Medi-Cal, and the first one is on straight Medi-Cal, and the second one is on Medi-Cal managed care. So I do have experience with both of these.
That is very interesting. Most families have one or the other. So tell us, Kathleen.
Yeah, you know, my son with Down syndrome, we are all covered under my husband's Kaiser plan. So we got Medi-Cal just to pick up the copays for what Kaiser does not cover. So he's just on straight Medi-Cal. However, I also have a foster daughter and she was on straight Medi-Cal, but I honestly found Kaiser easier to deal with. So I switched her over to managed care and now she can go to the same pediatrician as my two biological kids. And it's all covered through Medi-Cal, but she is, it acts just like a Kaiser patient. You know, she has a Kaiser number. We go to our Kaiser doctors. She gets her blood drawn at the Kaiser lab. So, personally, here in Contra Costa County, I found it easier to do the managed plan. The only reason I don't for Sam is because we already have a pretty comprehensive Kaiser plan that he gets first as his primary. The other thing I was going to say about it is if you apply for Medi-Cal and it is just a secondary coverage like it is for my son with Down syndrome, I have found that when you talk to Medi-Cal, sometimes the people that you get don't understand that and they keep trying to put you in a managed care plan. So you have to really spell out, I already have X insurance through my employer or through my spouse or whatever. I am only doing this as a secondary. And sometimes people get really confused and you can always ask for somebody else. But it is a little bit tricky to navigate that. And the other thing I wanted to say was just in general, the reason why Medi-Cal is really important to know about, a lot of reasons, but for our families, first of all, the copays get really pricey for services. I'm sure a lot of you have found that. And you know, it seems like $20 here, $15 here, it really adds up. If you track it at the end of the year, it really adds up and Medi-Cal will cover those copays for you. And the second thing is, if you're interested in IHSS, which Sheridan is going to talk about in 2 weeks, you have to have Medi-Cal to qualify for that. So if you're kind of on the fence and going, well, I don't know if I want to go through all this paperwork, but you know you're going to want to apply for IHSS, you want to get started getting your Medi-Cal paperwork in order.
I want to emphasize that it is so much smoother if you have access to Medi-Cal to then look at some of these other programs. It can save a lot of time. Sometimes people even get consult from different public benefits offices of, oh, you have a child, your child doesn't qualify for IHSS, which is not true. There are IHSS programs that do serve children. So important to have. I really appreciate you sharing that, Kathleen. It definitely is worth it. you know, I hear from different families in terms of what they prefer, if they prefer managed care or through another program. Kathleen brought up a great example, meaning when you already have private insurance, and if you have loved ones or kids that are on a certain plan, and you have options, again, here's where some benefits counseling can be helpful. And in some cases, you can run the numbers in a calculator to be able to see which approach is going to be better. And then also taking a look at your county health services or your county Medi-Cal page that will kind of detail a little bit what the options are in your particular area. Because remember, there's 6 models, and within those models, there's different options in terms of what you can access. Okay, thank you. Great questions. So I'm going to share screen, and we'll dive back into Medicare. How's that sound?
Great.
Okay.
We did get one more question. It says, what is the best way to request to keep your dependent adult with special needs in their parents' insurance? So this is sort of diverging, but I don't know if that's anything you can address, or should they reach out to you separately?
Let me see, is that in the chat?
It went straight to me, actually.
Oh, okay. Can you repeat that?
Yeah, what is the best way to request to keep your dependent adult with special needs on their parents' insurance?
Yeah, so generally, I think the fastest, there's a few different ways, but generally talking with your child's pediatrician and being able to get support. In some cases, you right from wherever you receive care can be able to get that handled, get a letter indicating to keep your loved one on insurance for as long as possible. So your pediatrician should be fairly knowledgeable about that, and sometimes that's a faster way than going through Medi-Cal and going from there. And as Kathleen mentioned, you know, if it's always better. So when you look at private insurance, Medi-Cal and Medicare, definitely apply for and get on whatever you can. It's always helpful to have multiple so that you can have the backups. And we'll talk a little bit about that soon. For Medi for people that are on Medi-Cal and Medicare, it's worth going through those enrollment processes because it makes a big difference in terms of your out-of-pocket cost.
And do you know, Sheridan, would that be the same if the individual has private insurance? Would you still recommend that they speak with their child's pediatrician?
Yes. So, you know, this for private insurance, yes, can be very helpful. That can be a fast way to be able to get that done. Sometimes it's depending on the private insurance. Sometimes it's an online form that you can submit. Other times you can just talk with the, I know families that have just worked with the front desk of their child's pediatrician and said, hey, here's how old my child is. I want to make sure that we don't have any problems for them staying on insurance as long as possible. So some offices are really helpful. And in other cases, you will have to go online and fill out some forms in terms of determination for that. Unfortunately, every private insurance works a little bit differently, just like Medi-Cal oftentimes works differently in different counties, depending on what's available. So let me share a screen here so we can get back up and running here. Oops, sorry. Just had a little blip in my network speed here. All right. Sorry guys, hang on one second. I'm just having a little network issue. I need enough juice. Okay, I think we're good now. Okay, so we're going to jump on over to Medi-Cal here. Thank you for the great questions, and I made a note of some of the additional resources that I'll send over email. All right, Alejandra, take it away. Oh, you're on mute.
Thank you for that. So now going on to Medicare, Medicare is a federal health insurance program, an entitlement program. It pays for variety of different health expenses. It's administered by the Centers for Medicare and Medicaid, known as CMS. A majority of beneficiaries are 65 and older. That's the traditional Medicare when you get close to retirement. In adults with certain medical approved conditions, and also qualifying individuals with disabilities, permanent disabilities, also can qualify for Medicare. There's many types of Medicare, as you can see here. Part A, the inpatient care and post-rehabilitation. Part B, the doctor services, outpatients, like your hospital doctor's appointment visits. And Part D, your prescription drugs cost. If you qualify, this is a savings tool for you to use with Part D. And also Part C, these are Medicare Advantage plans. Many can see if they qualify for this cost savings with Part C.
Yeah, and I would just say Part A can also cover some limited home health care and skilled nursing in some cases. Part B can also cover some tests and screenings. Note that here's where Medi-Cal can help cover some of the premiums for folks that qualify based on income. So that's, you know, one of several areas where Medi-Cal and Medicare can intersect and help work together. And Part D is in dog. Part D, that can also be a standalone plan, right, Alejandra?
Correct. And so the Medicare Advantage plans, as you mentioned, are covered through private insurance companies as well. Some Part C can also cover drug coverage, your medications, and also the original Medicare Part A, that Part A and B don't cover, like eye exams, hearing aids, and dental care. So these are just some examples. Sheridan, I think you're muted, Sheridan.
Thank you. You gave the favor back to me. I wanted to mention that for private insurance companies, oftentimes, in some cases, every year they need to renew their contract with Medicare if they're offering the Part C plan, kind of as an FYI. And so, you know, in terms of eligibility, we mentioned earlier, and some folks are automatically eligible with Medi-Cal. If you're 65, your initial enrollment period begins 3 months before your 65th birthday. It includes the month that you turn 65. If you have medical insurance coverage under a group health plan, either based on you or your spouse's current employment, you may not need to apply for Medicare Part B. So there's, you know, a special enrollment period for that kind of Medicare eligibility. And there's a whole section on the Medicare.gov that talks about special enrollment periods. So it's something to look at. There's certain times of year when you can either change your coverage or when you can get on a different type of plan. So just keep in mind, it's a different schedule and there's different eligibility periods compared to Medi-Cal. But for most of us that are here on the call today, they're going to be a little bit more interested in some of these other eligibility categories. So that includes adult children of parents who receive Medicare and may also be eligible if that child has a permanent and significant disability occurring before the age of 22. People younger than 65 with permanent disabilities can be enrolled in Medicare after they've received SSDI for 24 months. Adults that have a permanent or significant disability occurring before the age of 22 can be eligible to receive benefits under SSDI's Disabled Adult Child Program. And again, that's where when you go through kind of the eligibility calculators, whether that's on a DB 101 website or some of these other resources we're sharing with you, pay attention to what you're enrolling, what part that you're enrolling for, so that you can make sure that when redetermination happens, that you're being redetermined for the program that you were originally, or that your loved one was originally under. Many folks younger than 65 have certain conditions that are eligible for Medicare as soon as they receive SSDI with no waiting period. For the Disabled Adult Child Program specifically, so the parents have to be currently receiving retirement or disability benefits, or if parents are deceased, that program can kick in. And that's paid directly on the parent's earning record. And in that case, the 5-month waiting period that's usually required before SSDI, that can be waived for folks. So again, lots of different programs. So use some of those calculators or identifiers so that you know what form to fill out. That will save you a lot of time. And just to note that coverage and services are the same for those that qualify for Medicare through age and payroll taxes, as well as through the disability. So it's very similar coverage and services. And there are no illnesses or underlying conditions that disqualify people for Medicare. So keep that in mind too, when you look at the eligibility categories for certain programs through Medicare. So we wanted to spend a little bit of time on this because this seems to be a question that I get a lot in my office is, how do I know if I'm dual eligible or Medi-Medi? What the heck is Medi-Medi? Or my insurance company is asking that, or my physician or a specialty clinician is asking about that. So, Medi-Medi or dual eligible, these are programs that obviously cover different services and have different eligibility criteria, as we just mentioned. And about 1.5 million California seniors and people with disabilities have both, are what they call Medi-Medi. And if you have both, this is just good to know, Medicare is going to be your primary. So Medicare would be your primary, and Medi-Cal would kind of fall in and cover some things that Medicare doesn't, or could cover some of the potential fees or share of costs that you might have through Medicare. And it's important that you keep both numbers, both cards with you, and make sure you mention those when accessing services. I would have to say that we hear about billing issues where one was billed and one wasn't. So like where I see Alejandra smiling, you get that too, huh? Yeah. So if you have a billing issue, one of the first things you probably want to find out is, did they bill Medicare and not Medi-Cal afterwards? That tends to happen a lot. So Medicare again is the primary payer, so they pay for things first, and then Medi-Cal comes in as the secondary. And if you qualify for full Medi-Cal, that means Medi-Cal without a share of costs, right? So certain programs, there's no share of costs for Medi-Cal. If you qualify for full Medi-Cal without a share of costs, then Medi-Cal will also cover your Medicare Part A and Part B deductibles and copayments. I didn't see anything showing that that's changed, with 2021. These things change sometimes, but I don't think that's changed. Also, if you are in a county where you can choose like a fee-for-service Medicare and Medi-Cal, make sure that your doctor or your hospital accepts Medi-Cal as well as Medicare. Find out that they can run both for you. Present both of those cards so that you can make sure that both of those can be billed, because there are some providers that accept Medicare but not Medi-Cal. Because remember, Medi-Cal, we have a rates issue, right? Medi-Cal, the rates are not so hot. So sometimes you have providers that will take Medicare, but they don't take Medi-Cal. So it doesn't matter if you're dual eligible, they won't run your Medi-Cal. So find out before if you're in that situation. One other thing I wanted to mention for Medi folks, that if you're receiving both Medicare and Medi-Cal benefits, the Part D, Medicare Part D benefit, that's going to provide your prescription drug coverage, not Medi-Cal. So Medicare will cover drug coverage. You have to be enrolled in that Part D though, okay? Or in the Medicare Advantage, the Part C. And there's a program called Cal MediConnect. That's a program, if you're in it, that you can get, if you're eligible to get in, then you can get your prescription drugs through Cal MediConnect Managed Care Plan. So again, here you have options, managed care plan or another type of way to access Medi-Cal. And again, I know that's a high level overview and there's a lot more to it, but we at least wanted to cover that in our time together. Just again, to kind of emphasize when we think about Medi or dual eligible, definitely if you can access both, if you're eligible or your loved one's eligible for both, that's going to be very helpful. Medi-Cal would typically can pay for out-of-pocket medical expenses when you also have Medicare. So that's very helpful. It can fill in those gaps for you. And Medicare can provide access to more providers because again, Medicare rates tend to be a little bit more stable and a little higher than Medi-Cal. So that's just some helpful hints there. And then, you know, if this group is interested, I don't know how old you or your loved ones are with Down syndrome, but we could do a whole section just on coverage for people who are working, right, Alejandra? I mean, that's a whole new world. But I think if we were to do a plug right now, it would be working is good. Working is good. There's ways to manage benefits, keep your public benefits, and earn a paycheck. Super important for our friends and family members with Down syndrome and with other conditions. And this is kind of the best resource, at least for me. And Alejandra, jump in if you have other resources. But the Social Security Red Book, that is your guide. You were going to say something, Alejandra.
Oh, yes. And I, like, as I mentioned before, I do this benefit planning with people, individualized plans if they're ready to go back to work.
Awesome. Or what if they've never worked before? What if they're
ready to start working? Yeah.
If it's a person who's a teenager, they're looking at, you know, life after school, right? This is huge. And in general, we can just mention that there's 3 eligibility kind of time frames. So there's some different kind of chapters or guideposts, right? So the trial work period, it allows you to test like how is work going to be for you. You can test, you know, how work is for you for 9 months or so. There's an extended period of eligibility, and that can begin after your trial work period, and it can be at least 93 consecutive months of you keeping your Medicare benefits, if enrolled, your benefits after the trial work period. And then there's indefinite access where the person is still working, but under a medically disabled program so they can continue getting their benefits. So like I said, we just don't have the time to dig into it today, but if you click on that link, and every year they update it. So make sure that you're getting, I think they have the 2021 version out. Get the latest one. So I believe they've published 2021, otherwise 2020. And that gives you everything you need to know, but can't say enough about the importance of working for all people. Employment looks different for everybody, but it's worth looking into. You don't have to lose your benefits. Do you want to cover a little bit about enrollment?
Oh, yes, about enrollment. Initially, the enrollment period is the first opportunity that you have to enroll in Medicare based on disability or age, 65, as we mentioned. You will receive your Medicare card by mail. You can also request a list of different providers so you can start making those decisions of what doctor do I go to, what covers what, and start calling before you go to your appointments to see if in most cases they do take the Medicare card. Medi-Cal is a little different, but as we mentioned, you always want to bring both to your medical appointments or to pick up prescriptions at the pharmacy. And okay, common issues, not knowing if you have Medi dual eligibility, that can be an issue. So you want to make sure you know where you stand. Call your medical provider or call Medicare and Medi-Cal. And if you don't understand out-of-pocket cost, missing the window to enroll in the program in Medicare, those are common issues. Not looking into programs that can help you with cost. And we'll talk more about looking into programs that can help you with cost in a little bit. Yeah, but these are some common issues that I have seen people come across.
Yeah, there's, the Medicare savings programs that can help with cost sharing. And then there's a federal program called Extra Help that can cover specifically some of Medicare Part D coverage.
Yeah, and so there's a great resource out there. It's called HICAP, Health Insurance Counseling and Advocacy Program. They provide free services to answer your questions about Medicare. And here's the information for you, their number and website. These people really know what they're talking about. They always have the answers. And so they can go over different plans, generic name brand medications. If you're paying too much for a brand name medication, they are there to help you with any questions you may have regarding medications, transferring into a different plan, qualifying for a new plan. So please use them. It's a great resource.
Yeah, and that 1-800 number can get you to the one that's specific for your county. HICAP, you can also go to the the HICAP website and then find the specific number for the area near you. But again, I can't say enough. I agree with Alejandra. HICAP is fabulous. They're really, really terrific and helpful from a rights perspective and eligibility redetermination, troubleshooting, really, really helpful there.
And another resource that we mentioned earlier is db101.org, ca.db101.org. You can plug in, they have different calculators to see if you qualify for different programs, what your share cost will be, those types of questions. Yes, it's a great resource for you.
Yeah, I got to tell you, if there was one website around benefits that I use more than any other my entire career, it's this one, DB101. Honestly, if we did not have DB101 benefits counseling, both for professionals and for people like me that have to kind of be a jack of all trades, I mean, boy, I use it all the time. So you can get information about SSI, SSDI, IHSS, certainly Medi-Cal and Medicare. Whether you're talking for a child, for an adult, for a senior, someone who's transition age, so who's leaving school district services and is moving into adulthood and looking at what the options are. I mean, it's a wonderful, wonderful site. And I know we're short on time. For those of us that can stick with us a couple more minutes, we'll share just a couple more slides here, but you will be getting an email. I'm going to email Kathleen and Marianne all of the handouts, the deck, also the recovery and clawback information that we talked about earlier. So FYI, so if you do need to leave now, just know that you're going to get everything in email. So putting it together, Medi-Cal and Medicare, you might qualify for one or the other or both. You have to think of them as different buckets, different groupings of services and benefits, depending on which eligibility program that you're in with Medi-Cal and with Medicare. We can't plug enough of the amazing professionals like Alejandra that do enrollment and benefits counseling. It makes a huge difference, even if you feel that you're pretty, like the situation that Kathleen talked about earlier, where you maybe have kids or family members that are on different plans, and you're thinking, does it make sense to get everybody on a similar plan or not? That's where benefits counselors can make a big difference. They can also let you know about changes in eligibility, because these things do change. That's why when we talked about the Social Security Administration Red Book, you want to make sure you're looking at the latest version, because these things do change without notice on the year. They're not going to change mid-year in generally. And it's important that advocacy continue for these programs to stay in place, and for both states and counties to contribute, their share of funding for that. A couple of other resources here: Medicare.gov. That's where you can download fact sheets. That's where you have enrollment information. They have a 1-800 number that can answer questions 24/7. The State Health Insurance Assistance Program, SHIP, terrific. You can get some additional personalized health counseling that's Medicare specific. So in addition to HICAP, that's the SHIP program can be very helpful. And Health Advocates, California Health Advocates, again, they have some great cheat sheets. They have some great articles. We put HICAP in there one more time. And then Department of Developmental Services, if you have some questions in terms of if you or your loved one has regional center services, how does this work? There's also some good directives and good information on the DDS website. And then my federal partners, Disability Rights of California, have some terrific publications. They have some great publications that speak to like redetermination, that speak to, there were some changes in 2020 that affect some older folks over 65 with disabilities. They have a new publication that just came out, a few months ago about that. DREDIF is the Parent Training and Information Center here in the Bay Area, but there are parent training and information centers all across California. You can look yours up at Parent Training Information Centers. It's a great place for additional advocacy, workshops, and resources. And then our favorite, DB 101, in terms of using those calculators so that you can make sure that you're not filling out enrollment forms that you don't need to fill out, that you're just filling out the ones that are helpful. Okay, and then Kaiser Family Foundation has some great advocacy tools and articles that do a great job, I think, of plain language explaining certain types of health benefits and certain programs under Medi-Cal and Medicare. And then Justice and Aging does some wonderful advocacy work here in California, so wanted to give a shout out to them as well. Great, and then our contact information there as well. And my apologies for us going a little bit over there, but we wanted to make sure that you had that information.
We do have a couple of last questions that came in. Do we have just a couple minutes to address those?
Great.
One of them is a two-part question. She says, I was told that in order for my daughter to be eligible for Medi-Medi, I have to wait for at least 2 years before she becomes eligible. In that case, do I need to apply for DAC first?
For DAC first, that's where in some cases, yes, that 24-month eligibility is required. I'm going to send you some information about that specifically. We don't have a slide on that, but yes, in many cases, there is a waiting period of 2 years, but it also depends a little bit on your daughter's situation. So let me make a note so that I can pull a handout or an article on that, and I will send that today. Let's go ahead and stop recording so that way.
All right.
Hello?